Everyone, thank you for joining us here at the Medical Society of the District of Columbia recording session on the Center of Disease Control Project First Line Project. This session is regarding infection prevention and control in the healthcare setting with a focus on best practices and safe workplace practical tips with a historical background. So I'm Raymond Tu on the board of the Medical Society of the District of Columbia, as well as chairperson of the Public Health Task Force of the Medical Society. And I would like to introduce our speakers. We have Dr. Earl Harley and Mr. Ricardo Gonzalez. Dr. Earl Harley is professor of otolaryngology and pediatrics and chief of pediatric otolaryngology at MedStar Georgetown Hospital. And he will take us off first regarding an important medical figure and why this person is important. Dr. Harley?
Thank you, Dr. Tu, and thank the Medical Society of DC. I do want to talk about a very important figure who actually was one of my professors at Howard. He is a historical figure who's little known in the medical world outside of preventive medicine, but his name is Dr. Poindexter. Hildreth Poindexter, born in 1901, just a little bit about his background. His parents were slaves. He went to a HBCU called Lincoln University, and then went to Dartmouth when Dartmouth was still a two-year school. Did well at Dartmouth, was able to go up to Boston and finish his medical degree at Harvard in 1928, and went on to Columbia to get his PhD in microbiology to become the first, or at least one of the first, African Americans to get both the MD and a PhD in history. And from there, for the next 60 years or so, he was very important in the field of preventive medicine, bacteriology, public health. And so that's Dr. Hildreth Poindexter. And his work, not only at Howard, he was professor in chief at Howard, but he also worked throughout the world in preventive medicine, worked in underserved countries. He worked in the Caribbean, he worked in Africa, in some places in Asia. He was a part of the public health service. So his legacy is that of teaching. First of all, one of his legacies is setting an example by avoiding or not going for the glitzy, fancy specialties, dedicating his life to the world of public health. And some of those lessons are still today. Some of the lessons that we learned from him and he taught the world are still important today, especially in this post-pandemic, COVID post-pandemic. So anyway, just a brief introduction to Dr. Poindexter.
Dr. Harley, share with us from your perspective as a leader in the field of pediatric otolaryngology and ENT, how the lessons learned from Dr. Poindexter are relevant today.
Well, it's hygiene for one. Hygiene, especially in this post-pandemic area, hygiene. And that was a lot part of what he taught and the examples, but the hygiene, they probably didn't have PPE, what we call PPE back in those days, but hygiene, PPE, all the things that were important that came out of, that we relearned. I don't want to say came out of COVID, we relearned it. And we knew it 100 years ago from the Spanish flu, as Mr. Gonzalez is going to talk about. But Dr. Poindexter also emphasized those things in his teaching and his travels throughout the world. So yeah.
Thank you so much, Dr. Harley. Could you share with us one of your priorities in infection prevention and control within your practice as a otolaryngologist?
Well, my priority, I'm a pediatric otolaryngologist, as you said, and I see babies for instance, yesterday I had a 4-month-old who had to take the surgery who actually had an infection. So just the personal protection, even though the pandemic is waning or has waned or has subsided, I still wear a mask when I'm around patients. So it's still a priority for me, especially these fragile young babies that I see every day. So PPE, certainly stringent hand washing or hand sanitizer before and after in a patient's room before wearing shields when I need to, wearing goggles if I have to, not only protect myself but protect the patient whom I'm treating. So those are priorities for me.
Thank you, Dr. Harley. And the infection prevention and control measures that you applied in your practice are very relevant to what Mr. Gonzalez will be sharing with us. So I would like to segue into Mr. Gonzalez. May I call you Ricardo?
Yes, sir.
Okay,
Yes,
Ricardo. So Mr. Ricardo Gonzalez, he's president of Nova Medical, which has been instrumental in providing incredible amount of infection prevention and control services throughout the DC, Maryland metropolitan area. So Ricardo is going to be speaking about an important historical figure, and as part of the theme of this presentation, reel it back to relevance for today. So Ricardo, do you want to take it away?
Yes, good morning, Dr. Tu. Thank you, Dr. Tu, Medical Society of DC. I appreciate this opportunity. I have been in this industry helping hospitals reduce infection. As we know, it's a $6 billion, non-related infections economy. So my goal has been to reduce infection throughout in Northern Virginia, DC, Maryland. But okay, Dr. Tu, the Spanish flu is a great story because it was back then in World War I, 1918, 1920. It was said that it started in the small military camp in Massachusetts. And the Spanish flu, it was actually, in my point of view, the way I look at it is like the viruses found an incredible weaponized system to travel. Because back then, the best way they described the World Health Organization is they used in the United States, they coined this phrase, cough and sneezes spread diseases. And it was interesting because the way they said it is that's the way they transmit it. So this incredible weaponized system that was back then is here today, and it will always be later, is transmitting it through person to person. By the way, NIH said that when you cough, you spread out about 3,000 air droplets, and when you sneeze, it's about 40,000 air droplets. Now, NIH said in December 2023 that this virus can be exposed and people can inhale it, these air droplets, and be contaminated through either air droplets or through mucous membranes, if you touch something. So the key is back then they coined this phrase, and then they said the way you avoid it, you prevent from this spreading is when you cough or sneeze, do it with your elbow, not with your hand, with your elbow. That's what's recommended. Now, Dr. Tu, also there was an NIH study that when you sneeze, the speed that comes out is about 100 miles an hour. That's the level 2 hurricane. And the same study said that those air droplets, they can travel 6 feet, the larger ones, and the smaller ones can go up to 26 feet. So when you sneezing or coughing, it's a great weaponized system, Dr. Tu, when you look at it. It just goes everywhere. So back then, it killed for what I've read different numbers from 50 million to 100 million people from 18 to 1920. Now, let's talk about these air droplets. Back then, maybe PP was not there, but also the chemicals to prevent killing this virus was not there then, but it's here today. Now, by the way you prevent it is, first of all, I believe is the way what I do it is you got to know your surface. In other words, this virus, when you spread it out, I don't know if you know this, but it's interesting. NIH said it. Copper, it can last up to 4 hours. The virus, it can last 4 hours. In carbon, 1 day. Then in stainless steel, 2 to 3 days. Wood surfaces, 4 days. Glass, 5 days, etc. So if you know the surface, now the goal is you have to learn how to kill it. Now, if you work for a health organization like a hospital, an institution that has a infection control committee, it's easy. You go to them and say, look, how are we going to treat this threat? What chemicals do we need to use to treat this threat? So, and you got to follow the instructions, the IFU, instruction for utilization, and whatever you're going to use to kill it. But also, by the way, what I teach my people is you also got to know the difference in between cleaning, disinfecting, and sanitizing. I mean, they're different, you know. If you're gonna clean something, it's soap and water, hand, you know, just wash and rinse. And it's dust, and you know, it could be just regular surface cleaning. No, sanitizing, it kills some of the germs. You use a sanitizing solution, but if you're gonna do disinfecting, you actually kill the germs. So you gotta know which one are you doing. You know, as a few moments ago, Dr. Harley said, the PPE, you know, back then you didn't have the same PPE you have today. So you also get educated what PPE should you use. If you're sick, my recommendation is just me, wear a mask so you don't cough and sneeze and spread disease. You know, you hold it there. But follow the proper, you know, protocols and procedures of the proper PPE you should be using. You know, back then we didn't have as much, we have plenty today. So if you don't work for a large institution, Dr. Tu, the EPA in 2023 did an emergent viral pathogen guideline in which they have all these chemicals coming into them, and you can look in there, what is the threat? Go to the EPA and see if it's coronavirus or whatever you're dealing with, you know. So there's a lot of things that today now that we didn't have back then, you know. And so that's, in a few words, Dr. Tu, the spread diseases, you know, sneeze with your elbow, you know. This is recommended by the whole World Organization back then. I think still works today. Stop the virus from spreading. Just be aware of how much it's, you know, when you sneeze and cough, what is happening.
Well, Ricardo, those are very, you know, I like the way you put it. Cough and sneeze, spread disease. I mean, that's exactly what Dr. Harley and you are saying the exact same thing. Dr. Harley, in your practice with children, how do you educate them regarding infection prevention and controls? Because the communication and the understanding of the processes are very different, whether it's a toddler or a child in grade school. What are some suggestions you have for our audience who may have children in daycare or going to school who are concerned about cough and sneeze, spread disease, like what Ricardo shared with us?
Well, thanks, Dr. Tu. The example that I used, I still wear a mask every day. I go in the room. So I'm setting an example for the parents. And the children, depending on their age, even the toddlers, they're very aware and they see this example. You have a mask on, I walk in the room, there's some sanitizer in every room or outside the room. That's the immediate thing I do before I touch them. So these are examples of this is important. This is how you prevent spread of disease. Although I'm not sick, obviously, if I was sick, I wouldn't even be seeing patients. I'm well, but yet I'm still taking these precautions, which sets the example that maybe we're out of the pandemic, but maybe we're not. But still, it's important to not transmit disease from one patient who may be sick to a patient who just comes in for a routine follow-up. So I think this example, and so you don't have to sit down and lecture a 2-year-old or 3-year-old. They see you. And oftentimes they'll have their mask, they'll pull their mask up. So I think it's just an example. So you teach by example.
Dr. Poindexter, Dr. Poindexter, Dr. Harley, Dr. Poindexter's lessons learned are so relevant today in modern times. What would be if you were to pick a fundamental tagline that we learned from Dr. Poindexter that you, Dr. Harley, can share with our audience, what would it be regarding the lessons learned back then that we can apply today?
Well, like I said, he was actually one of my professors. So I didn't know him personally, I knew him as a professor, but the lessons, it was the examples that he set, the things he dedicated his life to between being a teacher and professor at Howard. He went to underdeveloped, underserved, medically indigent areas throughout the world. So the example was it's part of your being a world citizen and a citizen in society, just treating others, looking out for things that we know, preventing disease by what we now call best practices. I'm sure they didn't use that term back in the, when he was around. He died in 1987. But best practices in terms of preventing, that would be the lesson, and just an example of how to dedicate your life to preventing disease and the transmission of disease.
Thank you. Ricardo, if you were to have a tagline for the lessons learned from the Spanish flu epidemic and COVID in your practice, in infection prevention and control in offices and hospitals and healthcare settings, what would it be in terms of what we learned from the Spanish flu, how it was addressed or not addressed, and reflecting on modern times?
I think it's what Dr. Harley just spoke about is be aware that the viruses have used us as weaponized systems. Wear PPE, be aware of your hand, sanitation. In other words, there are what's called prevention controls already set up everywhere, like hand sanitizers, masks. Be aware that you could be a transmitter, that can hurt somebody else that might have an immune system that's lower. So that's what I would say. Be aware of the control centers that are already set up for you. Utilize them, and be aware that you can protect somebody by just being aware of